My name is Christina, and I have a lovely, darling, soft, gentle lady in my life, and she's 80 plus at this time. She'd be mortified if I said the right age. And she suffers from dementia. And as the years progressed, it got worse and worse and worse. Her symptoms, I guess, escalated. And we got to the point where we were trying everything. We went to different doctors. We tried everything. And to be very honest, I was very opposed to giving medications because I didn't want that. So we did try a lot of holistic, different approaches, but it got to the point where we did not have an option. So she would wander and go off, and we live in a busy street, and we live in a wooded area. So that was always the dangers. We went through 6 different, very reputable caregiving organizations here before 5 of them quit. She was not eating. She was not drinking. She was wandering. She locked us. I mean, we had everything. We had the police here a couple of times because I just couldn't control her. The worst part was when she'd run away and she would, if she thought I was her mother and someone corrected her or something, it was not the aggression, because I could deal with, like I told the doctor, I can doc, but it was the fear that you'd see in her eyes. And it was just, she was scared and she didn't understand what was going on. And the worst is she had, it's so hard to explain unless you've been there. There was no joy. And we also tried therapy. We tried physical therapy and mental because we felt she could work out. We tried, I even tried the holistic healers. I had a Reiki healer in here. I had a massage therapist. I tried supplements with them. Yes, magnesium. Yes, because the holistic healer and the chiropractor came. I had 3 different neurologists from Stanford. I had, I can't even tell you everything that I went through. But yeah, we tried everything. We tried the macrobiotic diet. Finally, I got a hold of you. I found your name and number, and I talked to you, and you came and saw her. And the first thing you told me was, okay, stop the insanity. And you got rid of half of the medications, more than half, remember?
Yes.
But by that point, by the time we got Dr. Lansford in here, I had 5 caregiver associations who wouldn't work with us. So I was paying people under the table who weren't licensed to come and help me and had no experience. So you also referred me to Tender Rose, which was also a lifesaver. And that's why I was so anti the drugs, because she would get so sedated that you couldn't, there was no joy there. She was just sitting there. She was asleep, awake, but asleep. You know what I mean?
You look like a zombie.
Yeah. And I was like, come on, you can't, she's not my friend. This is not how you want to live your life. She needs some joy, and you need, no matter what your illness is, you need to have that joy. If it's just to enjoy an ice cream cone or a hawk flying by or a pretty flower that came out. It just wasn't how I could see her life going, So we did get her on all the medicines you named, and it was remarkable. It wasn't overnight by any means. I'm not saying that the next day she was, first of all, the fear. That was the worst part for me. As I always said, it was the fear that she had. And a lot of her delusions were scary ones for her. And like she would climb in bed with me, and I just have to hold her and tell her she was safe. And that went away. Like, she hasn't had those episodes. And for me, those were the saddest, because whether they were delusional or whatever, they were real to her. And it was very sad to see that. So those went away. She wasn't seeing, people, she wasn't having those delusions, but she didn't want anyone else. She just wanted me. And at that point, I needed to get to work. I needed to be with my daughter, with my mom. I could not be at her beck and call 24/7, which I did do for about a year and a half when we had all this problem going. So at that point, with the good caregivers and everything, the problem was every time I would leave the house, she would act up a bit.
She'd go ballistic.
Yes, she did. Yes,
Yeah.
she did.
So
She'd throw things.
Right. We found a good dementia community, which actually was very scary to you, you know.
Yeah, it was terrifying. It still is. It still is. I think part of it's my culture too. I'm Hispanic and Filipino. And for us, family is family, and you take care of your family. And Lynn is my family. We say she's my friend, but really she's my family. And my whole family thinks of her as our family. So for me, it was always, well, I can do this. I can take care of my family. That was very instilled in me. So it was a very hard leap for me to get her there with the medication. And I think a lot of it is the medication as well. 2 months later, she was actually telling me, well, you can leave now because I have plans. Or why are you here visiting? Because I was going every day to visit her, and I'd be there for 4 hours. And she'd be like, but I have plans with my girlfriends now, so you can leave now. And Lynn is thriving there. She's made friends, and she looks forward to activities. She tells me about her day. It's been a really positive experience. Now, you know, nothing is perfect. We definitely have our ups and downs. There are issues that, like we had here. So I'm not trying to make everything sound rosy and perfect. We still have our issues, and you definitely have days where I call you and I go, she's a little agitated, and but there's someone monitoring it all the time.